talk risks on in-house and I'll give you risks on outsource because there's pros and cons to both. Risks on in-house team are if you have a small enough team where if one or two key people leave, that the whole operation falls apart because it takes time to hire good people. And the other piece I see with risks is you have maybe a small billing team, but you have nobody overseeing that from a high level perspective who understands the metrics, who understands the operational risks in order to keep things moving smoothly, right? You can have one or two billers, they're doing a good job, but if they don't truly understand how the billing piece integrates into the whole workflow of the clinic, you may be okay for now, but one or two hiccups with new front desks, eligibility denials, a new provider who's got coding denials, those things start to snowball. Next thing you know, you've got our insurance AR climbing, and then getting out of that hole with just those one or two people gets extremely challenging because you figure it out late and you get into a point where you can't dig out. So what I mean by that is KPIs, right? And you and I, from a business perspective, like we're used to that. Like you look at KPIs, you look at them every month, maybe more than once a month, depending on what you're tracking and trending. And for the audience, right, key performance indicators. But, really this comes down to, I own a practice, but I am also, maybe a clinician. I'm seeing patients. And so you may not feel super comfortable with those metrics. And so it's very easy to go, you'll click into them and you'll kind of glance at them and you'll be like, I think I know what this means, or I want to know what this means, but I don't. And you may ignore them. But I think the most important thing practices can do is not to ignore them, ask questions of your team and say, okay, what does this metric mean? And if you're not getting any metrics, ask to start getting those. And again, from a business perspective, whoever you've partnered with should be able to sit down with you and go over somewhere to start if you have nothing today.
Welcome to the Brainwaves podcast by Opus, where we sit down with leaders in the behavioral health and technology and healthcare operations to explore what it really takes to create better care from inside out. I'm your host, Humberto Bugliotto, and I'm also the CEO of Opus. Today's guest is someone who's been seeing healthcare from both sides of the curtain, both on the hospital boardroom and private practice front desk. Heather Signorelli is a board-certified pathologist, an executive at a large healthcare system overseeing lab services for nearly 200 hospitals, and the founder of NatRevMD, a medical billing company helping physicians increase collections and reduce operational chaos. That sounds good. Heather is here to talk to us about the business side of healthcare, how it works, where it breaks, and what physicians can do to build more sustainable practices. She's also someone who believes deeply that doctors and clinical staff can understand their numbers, lead teams, and build businesses without burning out in the process. I agree with that 100%. Heather, welcome to the Brainwaves podcast. Welcome to the Brainwaves podcast. Let's start with your story, maybe your hospital executive experience and also founding a billing company. How did they sort of come about?
Yeah, I think I've kind of done a little bit of it all. And thanks for having me on the show today. So pathologist by background, kind of really started out in residency, loving the business side of medicine, got kind of engaged in some stuff where they were putting me on planes and sending me to rural parts of Canada to figure out labs and help them operate more efficiently. Fast forward, out of training, kind of got put into pretty much a corporate role almost immediately. Again, not really by design. It just kind of happened that way. And then I've been doing kind of corporate healthcare maybe 10 years. And then we opened up our company, my husband and I, about 4 years ago. And we opened up a billing company because we were seeing those issues, right? Like docs in general were not taught a lot of really thorough healthcare business stuff in training. I felt like there was a better way to kind of combine education, really understanding operational workflows with being able to make sure that practices, can stay independent should they, decide to that was for them. And so we've hired a rock star team. I think we've got close to 70 people now.
Nice.
And it's been fun. I mean, it's been a wild ride. I'm sure you can probably agree with me that business is not easy. And this has been nothing short of easy, but it's been really fun and rewarding. So
it's fun to figure out the challenging parts of business, right? When you're there and somebody has a problem and you get in there and you're like, I think I can figure this out. And you do. That's the excitement, right? And even if it's hard, that's why we're in business.
Yeah. And, I don't know if you have kids or not, but when you have children, right? Everybody just talks about the rosy part, like, oh, they're so cute and it's so lovely and you love them, but nobody tells you about childbirth and like all the sleepless nights and everything. You get bits and pieces. I think business is the same, right? You hear about the rosy side, oh, autonomy and freedom and all of that, but nobody tells you about, the staffing and the HR stuff and putting people on pips and like all this, the hard stuff. Granted, that doesn't make it not fun and rewarding. It's like the real side of it. So yeah.
I heard a sentence once. Somebody said, running a business is like chewing glass and looking at an abyss. I don't entirely agree with it. Sometimes it feels that way, but yeah, I think it's rewarding to, obviously, as like we sell software, we sell technology solutions. It's, you're trying to paint a rosy picture, but when you're having a conversation with a customer, you also want to talk about the stuff that's going to be hard. Like one of the things that comes up for us a lot is onboarding and data migration, right? Huge. We don't
Huge.
sugarcoat it. It's going to suck. It's not going to be perfect, but we're going to take you through the entire process. We're going to handle a lot of all of it for you. So it's, I guess, just being upfront about it. So what are some things that, I mean, you're talking about the parts that kind of the challenges, right? So what are some of the sort of mistakes or, one of the things I mentioned on the introduction is that you want clinicians or doctors, whoever is running the practice, to really know their numbers. What are the things that you see most often when you go in and try to help a company? What are they doing that's like right away, like you should be looking for this because 9 times out of 10, that's what's happening.
So I would say it's two things that I would say most of our practices struggle with, whether they have an in-house team or an outsourced team to start with. It's being super engaged with what your metrics show and what they mean is the first, right? So what I mean by that is KPIs, right? And you and I, from a business perspective, like we're used to that. Like you look at KPIs, you look at them every month, maybe more than once a month, depending on what you're tracking and trending. And for the audience, right, key performance indicators. But, really this comes down to I own a practice, but I am also, maybe a clinician. I'm seeing patients. And so you may not feel super comfortable with those metrics. And so it's very easy to go, you'll click into them and you'll kind of glance at them and you'll be like, I think I know what this means, or I want to know what this means, but I don't. And you may ignore them. But I think the most important thing practices can do is not to ignore them, ask questions of your team and say, okay, what does this metric mean? And if you're not getting any metrics, ask to start getting those. And again, from a business perspective, whoever you've partnered with should be able to sit down with you and go over somewhere to start if you have nothing today, or help you understand what you're looking at. And it's so, so important, right? I mean, it's just really important to make sure you know what you're measuring, why it's, at certain levels and where your goals are. So that would be the first thing. And the second would be, so in healthcare practices, billing insurance, you really need to know if your patients have active coverage, what's called an eligibility check.
Mhm.
Really, really important, and probably the number one mistake I see in all practices. Typically, this is done in those front office staff roles, which tend to be, more entry level sometimes, a lot to turnover. Really important to have that group of individuals trained. I mean, back to your onboarding, and it's just onboarding, training those individuals so that they know what their duties are and making sure that those are done reliably every single day.
Yeah, I agree. We had a Jacob Lynch from HCA on the podcast a
Okay.
few months ago, and he works with mergers and acquisitions. He's basically, that's what he does. He's a broker for behavioral health deals. And he said you'd be surprised the size of deals that we get involved with,
Hmm.
and the owners just don't know their numbers at all. And I was actually, I mean, I wasn't shocked because we work with, organizations of all sizes. So we see that too on the RCM side. Do you, with your customers, do you help them kind of get organized for potential merger and acquisition? Or like, do you kind of help them with that angle as well? Or do you primarily focus on the RCM work?
We can. I think with mergers and acquisition, you're just trying to understand what is current state, where is your goal in terms of, what do you want metrics to look like for a potential sale or exit? Because you got to clean stuff up. I mean, at least I think in order to have a good M&A process, you need to clean stuff up and get it ready, because you're going to be more attractive to buyers, right? Buyers don't want a mess. They don't want to walk into a place with billing metrics a mess, or financial metrics a mess, or staffing operations not optimized. Obviously, we know, and we know that there are sales of companies where all of those things are true and happen all the time. But to me, I think for a successful M&A, you've got to get all of that in order first. So yeah, I mean, our team does help with kind of operational workflows and consulting and getting places where they need to be, but our bread and butter is really RCM.
Gotcha. So there's a frequent debate in the behavioral health space, in-house billing and then outsourcing it to an RCM company, right? And everybody has their own opinion. Everybody thinks they have it down path or they have the right solution. Give me the elevator pitch on why companies should consider an RCM services company rather than doing billing in-house.
So I think the biggest risks on either side, right? So let's talk risks on in-house and I'll give you risks on outsource because there's pros and cons to both. Risks on in-house team are if you have a small enough team where if one or two key people leave, that the whole operation falls apart because it takes time to hire good people. And the other piece I see with risks is you have maybe a small billing team, but you have nobody overseeing that from a high level perspective who understands the metrics, who understands the operational risks in order to keep things moving smoothly, right? You can have one or two billers, they're doing a good job, but if they don't truly understand how the billing piece integrates into the whole workflow of the clinic, you may be okay for now, but one or two hiccups with new front desks, eligibility denials, a new provider who's got coding denials, those things start to snowball. Next thing you know, you've got our insurance AR climbing, climbing, climbing. And then getting out of that hole with just those one or two people gets extremely challenging because you figure it out late and you get into a point where you can't dig out. Now, on the flip side of that, right? Risks with outsourcing is if you pick the wrong outsourced partner and say they just 100% offshore and you don't, again, have that high level support who are doing those same things of audits, understanding your metrics, fixing operational workflow issues, you're going to have the same outcome. So to me, it's really about the depth of knowledge in your team, the oversight to really understand those metrics and fix those operational issues. That becomes more important than anything, whether they're outsourced or insourced. And obviously, cost comes down to it, right? How much AR are you leaving on the table? What are you paying your team? What could you outsource? We'll never claim to be the cheapest, but our team is very focused on making sure that you have the right operational support because otherwise things always fall apart.
Yeah, I agree. Do you normally work 100% RCM services provided by your company? Do you work kind of a hybrid model with some companies if they have maybe some staff in-house and they want to kind of have, your expertise kind of plug into their operation? How do you normally model it?
Normally they're all, kind of 100% us. Again, we've done some consulting arrangements where we come in and kind of help and fix things. I will say most of those have ended up coming back to us saying, hey, can you just take over the whole thing? They would lose one or two staff members or whatever. So I would say we either model kind of in a consulting fashion or a full outsourced fashion. Granted, there's kind of a hybrid of engagements of what kind of leads up to us completely out, being their outsourced partner.
Gotcha. You mentioned the offshoring, and I think that's actually a pretty key aspect of success, depending on the services that you're providing. You guys are 100% US based, or
So we have two models. We have a full US based team that's available should practices choose that that's not for them. And then we have a hybrid model. So all of our leadership team is here stateside and they are kind of in the accounts every day, auditing, doing that kind of real evaluation of what's going on for the practice. And then we have billers and coders who are offshore, and then our staff onshore is also certified billers and coders. And for me, that hybrid has been key. And we've kind of played around with different models over the years. This works. This keeps our metrics in line. This helps us catch issues in line quicker. Because here's the thing about medical practice, and I'm sure you know this. I mean, it's really probably any business. There will always be issues. You will never have a business without issues.
that's true.
So it's just a matter of what are the issues, how quickly are they identified, and how quickly are they fixed?
Running a business is literally solving issues for other people.
Correct. Every
So
single
you're
day.
going to have internal issues too.
Yeah. And so I think that whether you have an in-house team or an outsourced team for billing, it's not just about, hey, can I submit the claims and get paid and pay post payments? It's, okay, can I identify like major issues or even minor issues before they become major issues quickly and fix them? That is the number one thing that billing companies have to do.
And so let's say I own Acme Behavioral and I contact you. I say, we do billing in house. We're leaving a lot of money on the table. We have, I don't know what the low collection, percentage collection. We think it could do better. What is your assessment? What is your process to determine whether Acme is a good customer for you and you're going to be able to help me?
So first is we'll do an audit where we're usually they're asking for certain metrics if they don't want us to pull them or pulling them for the practice and really understand what's going on, both high level as well as kind of in the weeds with denials and understanding why are they getting denials, and then putting together an analysis to compare, what is their in-house, cost in terms of the people that they have in place, what money or percent of money that they're leaving on the table, and then what would that look like in our hands. The tricky part is it's very much a marriage between a billing company and a practice, and there has to be communication both ways. So there has to be someone dedicated in the practice who can help assist. Because again, those eligibility issues typically are still housed in house at that front desk individual, which doesn't always have to be that way, but typically. And so if that's your weak link, unless we're all committed to fixing that together, that will continue to be your weak link. Our team will help do the training and policy development and everything. But again, at the end of the day, we've got to make sure that the practice is on board to help fix those operational issues together if they exist.
Right, right. And how long does that process usually take? Like just that assessment to kind of.
We typically, a week, 2 weeks. It depends, how large the practice is, how many locations it may be. So larger practices, if we're pulling from different, location EMRs, depending on how they've structured their data, could be longer. But yeah, I mean, typically within 2 weeks.
And then I'm a good customer. Let's get going. What does that look like then? What is the onboarding process like? Because I know that there's like a ramp down process and you guys get involved. There's usually a lot of anxiety around that
Mhm.
because there's like a revenue valley of sorts. So what does that look like? And how do you work with them to kind of, I don't know if minimize is the right term, but just to kind of curb their anxiety around revenue because that's what's paying the bills, obviously.
Yeah. And this is always an interesting conversation. With most situations, we may not be taking on old accounts receivable, right? We pick up on day one and we take over new claims because typically old teams are closing out the old stuff. Doesn't always have to be that way. Oftentimes the old team burns out of energy and we end up having to come in and kind of clean it up. So I would say that the biggest risk of revenue is not the new claims process, it's the stuff going on with the old AR, right? Because you're always getting paid for stuff that happened 30, 60, hopefully not longer than that, but 30 days ago. So we have obviously a very intense checklist. We take on as much of that responsibility as we can, but it's really working with the practice to say, okay, where's the division of labor? What's going on from a software perspective? How are we going to get our team access, to all the payer portals, which is the most painful thing I've ever had to do, is payer portals.
I know.
And
I
they
mean,
just
I
suck.
really wish somebody would just come up with a Google sign in for a payer portal where you
I
just
know.
log in everywhere.
They have some of those that are starting to surface, but they're so expensive that the practice is like, I'm not going to pay for that, so but anyway, so that's all coming, but that's the biggest piece is just getting everybody on the same page. So I would say that takes anywhere from 2 to 4 weeks. I like to have that 3 to 4 weeks if possible. Sometimes we're not given, we need to move faster. It just depends what's going on with the practice.
Do you normally take over accounts from other RCM companies or from in house, or is it a pretty fair, like even
Pretty fair
mix?
split, I would say. I mean, and we've even had the interesting situation where we've had practices come to us and they say, we're not happy with our in-house team, but we like this one really great person. How do we make this work? And so in several of those circumstances, we've actually taken on that in-person or that in-house person. They go remote, but then they are hired as a W-2 on our team. And so, yeah, and that's been a interesting, actually really cool way to have
It's a
talent.
win-win.
It is a win-win. And actually, we've some of our most amazing employees have come in that manner.
Nice.
But so I would say it's a split. I mean, we're taking over from both. I mean, lately it's actually been from a many in-house teams, but I would say split overall.
Is there like I guess a revenue threshold where it kind of makes sense to be doing it in house or outsourced? Because I feel like in our conversations with our customers are either they're too small to have a company come in, they're startup or they're not established yet. They don't have a kind of a steady flux or influx of revenue. And so they end up doing it in-house, but they kind of, halfway do it and end up, paying the penalty anyway because they're not billing
Getting paid.
correctly. And then when you have like on a higher end of a much larger revenue, they usually want to bring it in-house because they think I'm paying X percent to an RCM company. If I take just that number, I can hire 5 people full time. That's what I hear all the time. So is there like a sweet spot, if you will, for RCM services?
It's funny, we've probably taken over, we have practices that are just one single doc, and sometimes that works if they've got somebody else in-house other than the physician who can help us kind of operationally fix some of those issues, because the issues are same whether you've got 1 doc or 10 docs, right? There's still eligibility issues, like, there's still denials, like, you still gotta know the stuff. One of our most recent clients we took on is a massive practice, had multiple in-house people, but at the end of the day, they could not ever secure the talent to have that operational oversight and have a really good set team that showed the metrics that they needed. And then we've had small practices where, they could probably pick either. They could have a 1099 person if that person is really trustworthy and you know that they can do it, or they've used us so that they have a little bit more of depth of resources that they can tap into. It just depends. I think in either way, the practice has to really be ready to be a partner, because I think that's the biggest struggle with any RCM situation, is really realizing, again, what are those risks, those I guess issues that you have in operations that impact the billing, and you've got to have good communication. I mean, running a business, no matter what, between clients and your own staff, communication's key.
Yep, I 100% agree. Do you help with what are the ancillary services you guys provide? Like, for example, in behavioral health, utilization review or like records requests, things like that. Or you mentioned the eligibility check. Some billing companies will help organizations kind of do that initial triage of patients before they get admitted. Do you do anything aside from the billing?
So we'll do credentialing, we do coding audits. We will help any kind of consulting with workflows and stuff. A lot of that times is just wrapped up into our billing services. And then we can do authorization, like prior auths and eligibility. I really like that to be housed within the person who is scheduling patients.
Hmm.
Now, granted, we can
Like the
hire that.
admissions or the
Yes,
scheduler, the admissions person.
scheduler, really, we can hire that person, but it really needs to be the person who's directly interfacing with the patients. It's just more success when you don't have to have a middle person where you say, "Oh, I've scheduled this, now you do this," and then you call it's just too hard. So there's creative ways you can get around doing that. But it really just depends on what are the issues going on in the practice, what do we need to fix, and what's everybody comfortable having in-house versus remote.
Yeah. You mentioned that you worked in Canada. Did I hear that right?
It was I was consulting as a resident. So, I think you can tell by now between my W-2 and all the things I do, I don't sit still well. So when I was a resident in pathology, I was put on to and doing some consulting where I was being flown to Newfoundland and actually going and visiting these labs in very rural parts of Canada to assess their operational needs and workflows. It was a very interesting experience, but really it was very educational for me.
So the part that I'm interested in about Canada is in the US, you always hear the conversation about our healthcare is broken and the system sucks and all of these things. And I have family in Portugal, so I know how the healthcare system works there. What is it that we're doing wrong in the US from your perspective in terms of how I mean, it's probably a separate episode of the podcast to talk about
Yes.
that, but there just seems to be a level of complexity in billing that is just kind of intentional. I mean, obviously it is a little bit intentional, but it just seems like there's so many layers to get anything done. I mean, we talked about the portal before. That's like a very small speck of it, but I don't know anybody who hasn't, like, we just a few months ago, my wife had a procedure and we're still getting bills for $100 here, $125 there. Sometimes they're from a lab. Sometimes they're from a random provider that worked at the hospital that she was at and was billing under them. So why is it so complicated
I don't
to do
Yeah.
billing in the US? Like, I know the other systems are subsidized, Canada, Europe, it's different because it's government backed. Have you thought about like if there was a way to reinvent it with commercial insurance, with the payers that we have, if there's a magic wand, what would that look like? And it just seems crazy.
It is crazy, and I don't know the answer to it. I think the biggest thing. Can you hear my dogs barking? We may just need
Yeah,
to
but it's
pause.
okay.
Okay, are you sure? They can
Yeah.
take it out?
Yeah.
Okay. Let me just answer that question and just mark it. So, the biggest thing, I wish I had an answer to this. I wish this was easy. It's funny that you say this. So, I was on a podcast, Dr. Sarah Smith, who does like charting stuff for physicians. She's awesome, but she's from Canada. She's in Australia now. She's been in the States. So, she's been in 3 different healthcare systems. She actually says, she's like, I'm not sure anybody has it perfect. She's like, there are issues with billing, and she's a family practitioner. So she's like, I've had issues billing in Canada. I have issues billing in Australia. I've had issues billing in the United States. She still thinks our system is more complex here, but she basically said it's not perfect anywhere and it's still a mess. And there's all these other things that she has to do in Australia now that she didn't have to do in Canada that, so I'm not sure. I just think the idea that um I get it that you have to describe what you did in order to get paid for that. That makes sense. But the complexities around all the things you have to document and all the rules around, well, it's bundled in this case and not bundled in that case is just extremely complex. I wish we could just like start over. But again, I don't know the right system. I wish I did. If I did, maybe I'd be in a very different role today.
Yeah. That's what I figured because you often hear about some things working better in different countries, and then you realize kind of it works better, but it comes with compromises. Like I know my mom had to have something done. She lives in Lisbon, and it took her like 5 months to see somebody. So, and she actually has a lot, and I didn't know this, but she actually has private insurance there too, which I thought wasn't even an option. I thought everybody just had the public option, but it's not the way it works. A lot of people have private still because you get seen faster, at least. All right, let's talk about, I'm sure you knew that we were going to ask you about AI. Let's
Yeah.
talk about AI and how that's playing a role in you. I mean, that's pretty much every conversation we have now with candidates for any position that work for us. How are you utilizing AI? I guess for you personally, how do you use it in your day to day? And then how does your RCM company use it for just optimization?
I'm using AI all day, every day. I mean, literally, it has changed really the game of efficiency, I would say at this point. And you do have to be careful with AI because it can spit things out that you're like, "Meh, it's not quite right."
Yeah, trust and verify.
Trust and verify. And it's funny because we see our practices using AI, and then they'll send us something that you can almost tell when it's AI or not when it's copied and pasted, and you say, well, yeah, but none of that's right. And so you have to be careful using AI on both sides. So I would say for us personally, it's a lot around researching or rewriting things. A lot of our staff may not have the most eloquent way to summarize something, and so it's easy for us to say, okay, take the email you were starting with, where it's maybe not as organized or not as bulleted, and put it in AI and help it rewrite a summary for you. Or if you're having to do a quick search, and enough about the topic, use AI, but, trust and verify. I really want to start using AI to actually do more tasks. It's funny, one of our leads actually emailed me this morning going, is there a way we can do AI with AR, calling AR accounts receivable, calling the insurance, to have that process. I've met with a few companies. I just don't think we're quite there yet. I think we're so close though. So it's going to be very exciting to see what the next 12, 18 months looks like. I'd love to get to a point where it's replacing manual
Grunt work.
grunt work.
Yeah.
So I think we're close. I love that AI's here. I mean, I'm trying to make sure my 7th grader doesn't cheat on his homework because now he knows how to use it.
I think that ship has sailed,
I
probably.
do too. I mean, and again, I want him to learn it, right? So it's not that I don't want him to use it, but I want him to use it in a responsible manner that makes his brain still learn how to think. But who knows? Maybe thinking's going to be so different for these guys in 20 years.
Maybe
I
it'll
don't
be
know.
overrated.
Right.
People often refer to the movie Idiocracy. I don't know if you've seen it.
I have not seen that.
It's so funny. And it's basically like everybody, I don't know, 100 years from now, everybody's just, dumb. And this guy was frozen in time, and he, like, all of a sudden he's unfrozen and he's walking around and everybody's just unable to complete the most basic task. I think there's a little bit of fear of that, but the reality is nobody knows, right? It's every time you read something about it is like, it's going to take over. It's going to be great. I just read something today like right before we got on the podcast, the CEO of ChatGPT, Sam Altman, said 10 years from now, people that are graduating college right now will be on a high paying job on the moon. I'm like, how are you even conceptualizing that sort of? I mean, we haven't even been able to put any, I mean, we
Yeah.
haven't been there in a long
Right.
time. So I think it's just evolving so fast, and people are rightfully, I think, afraid of what it could mean to me. It's displacing a lot of people already. But I do think that at least I like to believe that it's going to be human plus AI, not human
Me
versus
too.
AI,
Me
right?
too.
It's going to be kind of a different version of what we're doing now, maybe more connected, because when you think about, like, if you were going to write an email to me, you would maybe draft it and throw it in ChatGPT and say, hey, make this friendly or short or optimize it. But it's still sort of an offline activity. You still have to type it in the keyboard and do this thing and the other thing, and then it generates. But maybe in the near future, it'll be more like using your brain. It'll just
Yeah. Just go.
happen. One of
Yeah.
the things that I've been using recently that was kind of a basic concept, but it's amazing how it changed my day to day, is an app called Whisper Flow. Have you
Oh,
heard
I
of
don't know
it?
this one. No, I'll have to write that one down.
It's I can email it to you, and I have another one that I'm going to send to you about the AI conversation to make calls. If you guys are thinking about doing that,
Mm,
we figured that out, I think, but I'll
okay.
share with you later. And basically, I'm sure you use a lot of talk to text. You
Mhm.
press a button on your phone, you
All the
say,
time.
hey,
I don't text at
message
all
Heather,
anymore.
period, comma, paragraph, whatever.
Yeah.
This just allows you to data dump everything you want to say, and it'll organize it in an email or a text or a thing. You can use it on your phone. You can use it on an email. You can use it on anything.
Ooh.
And it's such a simple thing. And
And
it
that's the
uses AI
whisper one?
because it's
And
called
that's
Whisper Flow. Yeah.
okay.
I think it's free. And I'm one of those things, I just made everybody in the company use it because essentially typing is overrated now. There's no reason you should be typing. You should just be holding a button on your keyboard and saying, yeah, send you an email, blah, blah, blah. And it's ready to go. Kind of like what ChatGPT would do for you. So I think there's going to be more of these kind of more faster access to the AI to give you the answer. Maybe it'll be like a chip on our brains that allows us to connect to things. But yeah, I'm always interested in what people think about AI because everybody has a different perspective. But I'm hoping that, I mean, with things like what you do and what we do, it's extraordinary. What you can, I mean, accounting for us when we were looking at vendor invoices here's a 500 invoices. Tell me what the pattern is where I got to go and talk to them about, this meeting that I have 20 minutes from now. It's just like, and to think that, I mean, I grew up in an era of flip phones, and when I was growing up, there were no phones. So to think that we're here now is kind of mind blowing, right?
It's fun. I think it's fun. I get nervous for my kids, but then I remember, like, if our parents or our grandparents were to think about us and like the internet coming out
My
and
God.
worried about our jobs and all that stuff, at the end of the day, I think it's changed how we work. It's changed what we do, but we still have jobs. We still have, stuff to contribute. And so I think it's going to be the same. I think it's just going to look different. I think it's really exciting, but I'm a tech nerd. So I like all the technology stuff. I like looking at Zapier and all the other tools that are out there, and so it's fun. And you're a tech company, so you get it, but it's fun. I'm
Yeah,
excited.
when people ask me like, what should I do about AI? I say, just stay with the times because you don't want to be the person that just denies it and then find yourself unemployed or unemployable. And every interview they're going to ask, what are you doing with AI? And you're going to say, you're not going to get the job.
No. And I think it's important to play in all the different tools, like I'm not a coder, but I've built something in Bolt.new. Like I've checked out Zapier, let's build workflows, Lindy that helps automations. Like I just love getting to know each individual platform. And there's so many right now. And those will all whittle down, I think, as time goes and you figure out like who's the best at doing what and operationally who's really good. But I think it's really fun. And I think taking those companies and applying to your operations. We've used it for improved meeting workflows, improved email workflows, improved education. So many places you can use it today without much cost and without much knowledge.
Yeah. Yeah, I agree. I mean, one of the things I think that's inevitable, and you might be looking into this already, is the ability to forecast things
Hmm.
more accurately with a lot of data without having to have a data analyst on staff.
Agree with
There's
you.
10 years worth of billing from all of my customers. Tell me what the patterns are, what where denials come in and things like that. It might be, you know, something I'm hearing a lot about, and I think that's anytime there's like a huge data set that requires a lot of time to analyze, it's I think a good use of AI. Um, Real quick, if we can go back to KPIs, we talked about it in the beginning. What would you say are the most important KPIs for a practice to look at? I know there are several, but what do you have to kind of drill into them and say, you got to know these numbers every day you wake up, every day, every time, every night you go to sleep, you got to know where you're at.
Accounts receivable denials. I mean, there's many more that we could sit and learn, but understanding what's that percentage of denials, why are you getting denials, and then accounts receivable split up by insurance and patient.
And where should a successful practice be from a denials perspective if they're doing the right thing? Is there like a magic number?
So yeah, I would say less than 5%. If the lower, the better. Not that it's just the percent. The percent's important, but it's really also understanding what kind of denials. Most practices, it's eligibility. Eligibility. Sometimes you'll get coding or bundled stuff or whatever, but understanding what those are, because that's the piece you have to fix in your practice. Everybody's going to get denials. You're always going to have denials. You just got to have a number of them and know what they are so that you can fix them. Some of them you can't fix, right? Some denials are just medical record requests, or, it's a non-covered benefit and you need to deal with that. But some denials, it's like, oh, that's telling you you have a process issue in your office that you have to fix. Because the eligibility denials, whether you're in-house team or outsourced team, are the things that is the number one reason when we take over a practice that you have 40-50% accounts receivable over 90 days. Because they start small, right? And this is why you see people leaving billing companies after 1 to 2 years, because you never fix the root problem. And so you'll see, oh, well, we had a few eligibility denials. We tried to fix them. We sent a few emails, but the problem never got resolved. And then soon 1 or 2 issues becomes 10 to 20 a week. And then now you have so many that it's hard to ever dig out. So especially if you're a new practice, you getting that hardwired, and just, it's not negotiable to fix those issues.
Yeah, that's good insight. Let's shift a little bit to, obviously you built NatRevMD with your husband, I assume. Okay. And how long ago was that? When did you guys start?
January 2022.
Okay.
And I was at a medical conference for, I guess the 2021, and just had friends who were really struggling with revenue post-COVID. And just everything got messed up in COVID, right? Just from a COVID perspective. And then they're digging out from a revenue perspective, increased patients. People just weren't, always going in. They were going to the hospital or something, but everybody's just kind of hunkering in. And just struggles with revenue. And so I'm a data nerd. I love a good spreadsheet. And so I'm, having revenue experience in my day job, I knew that with the right people, with the right team, with the right process, this could be done better. And it's just it's funny. We never intended to grow a company to this size. It started with one person and it just kind of grow from there. And we have about 70 people now.
Nice. And how did you balance being full-time job to creating a company? I always ask this from entrepreneurs because I know a lot of people that want to start a business and they're unhappy with their job, or for whatever reason. People start businesses for different reasons, most of the time to solve a problem, like we talked about before. How did you balance hey, I've got to continue to do this job that I'm doing now, and I've got to start this business. And at some point, this is going to become the main thing, and I'm going to get out of this. How did you balance that? You have kids too, so that must have been challenging.
I involve my son who's in 7th grade. I involve him. So if I am working on the weekends, which in the early days, that's when it was nights and weekends, right? Kind of had my day job and then the nights and the weekends for the other stuff. I involve my kids. They know what's going on. They know I'm recording a podcast. They know I'm, writing this or looking at these numbers. And so I think that's number one, is involving everyone. I mean, my kids were old enough to where they could understand that, especially now. And I would say there is no balance. I think if you pretend that there's like this perfect balance, I think it's all it's a prioritization, right? And so in the beginning, I was prioritizing that, we wanted to get this business off. And so that meant evenings and weekends, because I do have a W-2. But at the end of the day, I think it's eased over time. Right now, I'm really focusing on the education piece and the podcast. And so my day-to-day role has changed a lot. And we have a rock star team. I would say it's hiring rock stars. I mean, and we haven't always had rock stars.
That was going to be my next question. What advice do you give to someone starting a business from scratch? I guess hiring rock stars is one of them.
In the beginning, you end up being a lot of everything. And so you're going to have long days, you're going to have long nights, and that's just it is the way it is. And so I think just realizing that it's not always going to be easy, it's not easy. But if you're prepared for that and you go, okay, it's going to be hard, like I'm good with that. And then the second piece is the moment you can hire somebody to take it off of your plate. And that could be an administrative assistant or it could be a director of operations, depending on where you're at revenue wise. Like you should not be doing tasks that are not meant for your zone of genius. And so if that means, setting calendar invites, if that means like paying bills or whatever it is that's outside of your zone of genius that you can afford to hire somebody, hire them and get that time back to do more revenue generating activities. That is the best key. But then they've got to be, you've got to hire the rock stars, and you may not be able to afford the rock stars in the beginning. So you've got to do the harder stuff in the beginning and take off the easy stuff. But then as you get better and as your company grows, then you can hire the rock stars to do the really hard stuff. But it's not easy.
No, it's not. We went through a phase in the beginning where we were growing pretty fast. So we were just kind of getting bodies in the door to keep things going. And we hired a lot of people that weren't the right fit for us. And we had to eventually go out and hire somebody else. It's easy to underestimate how long it takes to get to when you have the wrong person in the wrong seat, or maybe you have a good person that's just in the wrong seat. They could be doing something else. You hire somebody for the wrong person. It's very problematic because the amount of time to get somebody, especially in something complex like revenue cycle, to get them spooled up, know all the moving parts in the company, and then actually being able to make an impact, and then you decide to part ways with them is like, for a small company, it's horrible. Hiring, I think,
Hiring.
yeah, kind of seconding what you said, I would say is probably one of the top responsibilities of people starting a company. Just make sure you hire the right people because it'll make or break the business.
And it's so hard because in the beginning, as you're learning your own business and as you are building it, you don't necessarily know what you need, or you don't know how to turn what you think you need into what you actually need and find a culture fit. And unfortunately, there's just some of that trial by fire. I would say if you do hire fast, fire fast as well, meaning like if you see a mistake or you see there's not a culture fit or 90-day trials, and make sure that you have an exit route. And not that you want to always do that. And of course, that's not the goal. The goal is to get to the point where you're really good at this. But I honestly think for most CEOs, it takes time, especially for a new business. It takes time.
Yeah, I agree. All right. So I'm going to wrap up with two questions that I always ask our guests. The first one is, if you weren't a DO, if you didn't go into that career and you didn't start your RCM company, what would Dr. Signorelli, maybe not doctor, but Heather would be doing today? What would be like maybe a dream career that you thought about a long time ago that you ended up not pursuing because of life? What would that be?
So I've realized I like to build things. I'm a builder, and it's funny in my
Which,
day
by the
job.
way, is very interesting because it's not the MO of a doctor. Like they're not
No,
spreadsheet people.
no. I actually probably think I was not meant to be a doctor, but I have family in healthcare. Granted, they did healthcare business as well, so it's like I feel like that was just an easy route. But I like to build things, and so I would probably still be building businesses. And it's funny, in my day job, I built something. I built a service line. We've built this RCM company. I just love to build, and so I think that is where my zone of genius is build.
Some kind of consulting, helping businesses
Yeah, just
operate.
just build an entrepreneurial type role, but in a different sector.
Yeah, we're on the same page. I've always said, if tomorrow we closed down Opus and we said, oh, let's go sell hot dogs, that's exciting because it's something I haven't done. And I would
I'm with
love
you.
to figure that out.
I think in the hardest part for our brains then is just the focus, like staying focused and staying here, because it's easy for entrepreneurs who like to build to be like, okay, I've built this. Now I want to build this. Now I want to build this. And so I love a good Alex Hermosi. I don't know if you listen to him, his
I
podcast,
do.
but yeah, him and his like, he's uber focused, maybe to an extreme. Uh, but his stuff's good. It's a good podcast.
Yeah, because if your mind is always wondering, there's so many problems to solve in the world that you can just never. You're going to be an Elon Musk that's constantly like trying
Correct.
to, and some people are successful at it, but it's really hard to execute. I always say, try to do one or two things really well, then 10
Hmm.
things mediocre. And I've been to blame before to do a bunch of stuff and just be in a whirlwind all the time. I
That's a
try to be more
visionary.
focused now. Yeah, you
That's a
have to,
visionary. I
because
mean,
other,
that's
yeah,
that's the hard part though as a CEO, like that is what got you here, right? But at the same time, it's like how do you harness that and put that into the right focus? Which is something that I think will take me a lifetime to learn. But it's also what fuels me, maybe you too, is that excitement of like, okay, let's try something really hard. It's
yeah.
fun.
The most exciting, the days I'm most excited about getting out of bed are the days where we're going to start something new.
Same.
Have a new idea. We are trying to figure something complex out, and it's like, oh, I wonder how we're going to figure this out. And then days later, you're like, yeah, we figured it out, because it's just a matter of putting the focus in it.
Totally.
My second question is, what books or podcasts um, do you recommend, two or three or as many as you want, to people like you that are starting a business or people in the healthcare space? What books would you recommend, books or podcasts?
So I do like the Dan Sullivan, all his stuff, right? 10x is easier than X, that book's really good. Alex Hermosi, huge fan. Another podcast that maybe is a little more out there is My First Million, the MFM, Sean Perry and Sam, I forget their names. Really good. And I actually think that he had Sam Altman, the
Centaur. Yeah.
Sam Parr, that's who it is. But I think they had that Chat GBT Sam Altman, who was the name?
Yeah. Yeah.
I
Yeah.
think they had him
Sam Altman. Yeah.
on. Yeah, so it's just a really good podcast. For people like us, it may get us into trouble because it gets you that visionary view, but it's just very entrepreneurship is lonely at times, and it makes you feel like you're around others who like to do and build and kind of create. And it's just very inspiring. Like it's like just something you put on for a walk or a bike ride or whatever. Huge fan. So those would be my
Nice.
recommendations.
I just looked it up because it is very lonely, actually. And it's nice to sometimes you hear somebody saying something that you're going through and like, oh, they get it.
Mm-hmm.
Right. Because a lot of times people offer advice, but they're not in the weeds. So it's hard to kind of, but yeah,
Yeah.
I'm gonna look it up.
Yeah, and what's nice about that podcast is it also tells stories of people who are maybe 5 years ahead of you. And so and whatever that means for you, right? Like you and I may be on different, parts in our journey, but you hear people who maybe are 5 years ahead of wherever you're at and you go, "Okay, I can get there." Like they were here, they dealt with these problems, but now they're here. And to me it's just really nice to hear.
Yeah. Awesome. Well, Dr. Signorelli, I appreciate you making time to be here today. This is awesome. You're a natural podcaster, so that made it easy for me. Thank you so much for being here. We appreciate you.
No, thanks for having me. I appreciate it. This was fun to get to know you.
All right. Thanks.